It's page number 361, chapter 17. Those who have the new textbook, the page numbers will be slightly different. Recordings will upload in a little bit delayed manner because since we are uploading the recordings on a regular basis, majority of the participants are skipping the live discussion classes. Okay. So just to check the pattern, the recorded sessions will be uploaded in a little bit delayed manner. Okay. So we'll start with upper gastrointestinal diseases. Okay. GI tract is divided into upper and lower GI. Okay. So first is your GRED, gastroesophageal reflux syndrome. Okay. So here, it usually happens among people who are in the age group of 20 to 40. Reason is poor dietary practices. Okay. Consuming too much of sugar, too much of fatty food. Okay. Lots of soft drinks, processed food. These can trigger GERD. Midnight eating habit. Okay, the in the middle of the night you feel like eating something and you overconsume something. Late night eating, that can also lead to acid reflux. Okay, and also if you undergo some stress or anxiety, usually you turn to eating more. Okay, long hours of starvation, uh, and also when the starvation period is over, you overindulge, you overeat. Okay, maybe 12 hours you're not eating anything, but when you eat too much of food. Okay, without controlling the portion. So these kind of eating patterns can also lead to GRD, gastroesophageal reflux syndrome. Smoking, also alcohol consumption, okay, these can also exaggerate your existing problem. So, following conditions are also associated with GERD, as mentioned in the textbook. If the esophageal mucosa, this is the esophagus, okay, that pipe-like structure that goes and it opens into the stomach, okay. So the esophageal mucosa, the internal lining, okay, this maroonish lining that you see, that is the esophageal mucosa. So that mucous membrane gets irritated because of gastric acid, whatever is the stomach content. Okay, if it is spilling back into the esophagus, that will get irritated because your stomach is capable. Stomach is made up of a certain mucosa that is capable to withhold the acid, okay, without getting harmed by it. But esophagus do not have that mucosa that can withhold the acid, so that will get irritated. Delayed gastric emptying, when the food stays in the stomach for a very long time, it is not moving forward towards the duodenum, towards the ileum, okay, into the intestine. The food is not moving forward soon. It is staying in your stomach for a very long time. That can also lead to reflux. Abnormal esophageal acid clearance rate, and also the sphincters of the esophagus, okay. Uh, this elevated things that you see, a little bit mountain kind of a thing, that is a sphincter. Okay, so esophageal sphincter, usually it should stay closed so that it can prevent the stomach content from going back into the esophagus. It's a muscle. Okay, but sometimes the sphincter doesn't work properly. It is not closed properly. It remains partially open or completely open. And in that case, the stomach contents can easily spill into the esophagus, go into the esophagus. and cause reflux. Okay, acidity and all what we call. So when this happen, what is the signs and symptoms? You will have cramping pain in your chest because it feels like heartburn. Okay, the regurgitation of the food that you consume, whatever you have had, it feels like it is coming back into the esophagus. Okay, throat issues, sinus issues, lungs. Okay, they also get impacted because refluxes. It can cause heartburn like situation, and sometimes over irritation. When the esophagus is overly irritated by the stomach acid, it can lead to esophageal cancers as well. Okay. So lifestyle changes that you can do to correct your GERD is, if you're a smoker, quit smoking, exercise regularly, sit up straight, okay, eat small meals throughout the day, chew your food very slowly, avoid avoid heartburn triggers, okay, wear loose comfortable clothes if possible. Wear women who wear tummy shapers and all, okay, tummy tuckers, tummy shapers, you also will face a lot of GERD happening. Sleep with your head and shoulders propped up, slightly elevated. Okay, minimize the amount of coffee and alcohol that you consume, and avoid lying down for at least 3 hours after the meal. Soon after the meal, don't lie down. Okay, so these are the things that can help prevent esophageal reflux. Lifestyle. Okay, dietary management is very important. If your diet is like highly processed food, sugary food, fatty food, too much of spicy food, you have to lower the consumption of such kind of food. And also weight management can also help. Then you have indigestion, also called dyspepsia, and the name for indigestion is dyspepsia. That is general term we use for indigestion is the general term we use, so everyone can understand. Okay, but the medical word for it is dyspepsia. So indigestion, in simple terms, it can be defined as it is difficult to break down the food in your stomach, in your intestine. Okay, because either you may be lacking certain gut bacteria, or certain gut bacteria has overpowered the other colonies of microbacteria in this in your intestine. Okay, so that could lead to indigestion. So usually it is difficulty in digesting food, and when there is this kind of difficulty, there is an uneasy sensation in your stomach. Okay, it can be not just because of your gut microbiome, it can also be because of some emotional tension, malnutrition, either eating too much or not chewing properly and eating, just chowing the food down, okay, without chewing properly. That can also lead to dyspepsia. And usually, indigestion on its own is not a disease condition. It can act as a symptom to some other underlying causes as well. Okay, like colon cancer, intestinal issues, bloating, okay, liver disease, high blood pressure. So these can also be the causes that lead to indigestion, the root causes that could lead to indigestion. So abdominal pain will be there. You may have bloating, like gas-filled tummy, nausea, feeling like going to vomit, regurgitation, belching. Belching is like uh, the air that comes out of your stomach through your esophagus. Okay. Burping, we say, burping, belching. Okay. In Hindi, we call it dakar. Okay. That is belching. And if you suffer from indigestion on a very frequent basis and on a very prolonged basis, that can lead to GERD, gastritis, peptic ulcers, okay, lactose intolerant, gallbladder issues, okay, if it is not treated properly. Control your fat intake, sugar intake, alcohol, caffeine, spices. Okay. Try to avoid too much of consumption of these food categories and see how your stomach responds. Allow you to allow yourself to understand if you're allergic to certain food or you're sensitive or intolerant to certain food. Okay. Taking that out of your diet can also help. So that is about indigestion. Next is peptic ulcer. So here, ulcer happens to the mucous membrane. Ulcer can happen anywhere where there is a mucous membrane. Okay, it will happen on the mucous lining. So what is an ulcer? It is just a wound where your mucous lining is eroding. Okay, there is a localized erosion of the mucous lining, of those portions of the alimentary tract or digestive tract that comes in contact with any gastric juice, that is your hydrochloric acid, your gastric juice, especially when it comes in contact with the HCl for a very long time and your barrier, the mucosal barrier is impaired. Okay, you can get peptic ulcer. There are various areas through which mucous barrier can get impaired. You're taking some drugs. Okay, you're taking steroids. H pylori bacteria has invaded your stomach. Stress, constant tension. Okay, that can also aggravate the situation. And majority of this kind of gastric ulcer or peptic ulcer is found in your duodenum, but they can happen in esophagus, stomach, and even in jejunum as well. Okay, but majority of it is seen in duodenal region of the GI tract. So again, the mechanism how this peptic ulcers takes place. Okay, if you are consuming too much of certain steroid medications, that can take away the capacity of tolerance of your mucous membrane. Okay, there is a gel that covers the mucus layer and that protects the mucus layer from uh, hydrochloric acid and all. Okay, that this gel production can go down. Okay, this mucous membranes gel production, mucus production can go down. Okay, and that can impact the mucosal barrier. So within your body also you have different levels of defense when it comes to protecting the gastric mucosal membrane. Okay, first is the mucus layer. Okay, then you have prostaglandins released, the hormones released, okay, locally in the mucosal region that can that can protect your mucosal layer from over irritation. Okay, any stimuli that comes to irritate the mucous membrane, it can prevent it. So symptoms of peptic ulcer, if you suffer from peptic ulcer, what are the signs and common signs and symptoms you see? A burning sensation in the upper abdomen. Okay, the upper part of the stomach region. There's a burning sensation, bloating. Okay, always the stomach feels like it is filled with air, heartburn, esophageal reflux can also be there. or when the mucosal membrane is getting irritated. Okay, even if it is not like towards the esophagus, towards the fundus of the stomach, even if it gets irritated, it will give you same kind of a pain. Okay, heartburn. The nausea and vomiting, frequent feeling of going to vomit, there is indigestion, not able to digest food properly. Dark stool, because it could be bleeding. This is the sign of bleeding ulcers that are bleeding. Okay, because when in the stomach or in the duodenum, when the bleeding ulcers blood get mixed with food, okay, it goes through the intestine and all, but it undergoes clotting. Okay, it is fresh blood, but it still undergoes clotting. That's why the stools, the feces that appears very dark in color. Okay, so that is a severe case of peptic ulcer. Then unexplained weight loss is also there. That leads to not able to absorb food properly in the intestine, or food is not getting mixed properly with the gastric juices, and that leads to unexplained weight loss. So these are the symptoms of a peptic ulcer. Diagnosis: you can do an endoscopy. There is a fiber optic scope that can be inserted through your mouth to visualize the internal mucosal regions of your esophagus, okay, its stomach, duodenum, just to identify where the peptic ulcer is. Okay, biopsy can also be taken to identify if it is converted into cancer or not, or if it is benign or malignant. Stool examination to find if it is a bleeding peptic ulcer or not. Blood examination, urea breath test. Here, an isotope of carbon isotope is given to the patient to swallow. Okay, and then after some time, the patient's breath, okay, the patient is asked to blow out into a tube, okay, to collect the air that the patient has blown out. And if there is if there is a presence of oxygen, okay, and the presence of that carbon dioxide isotope in that air that the patient has blew out, okay, that confirms the H. pylori bacterium, Helicobacter pylori test. That is a urea breath test. And upper GI barium study, again a barium swallow. Okay, we call it barium swallow also. Barium isotope along with uh, something to drink, okay, is given to the patient so that the barium will cover the entire lining of your esophagus, stomach, duodenum, intestine, wherever it goes. And wherever it goes, the barium will line the entire mucosal region in such a way that when you take the X-ray, barium is works opaque when X-ray rays hit. Okay, so in the stomach, wherever the peptic ulcer is there, or in the duodenum, wherever the peptic ulcers are there, this barium will cover that also. The barium will fill up those eroded spaces. Okay, and though that you can visualize in the X-ray exactly where the peptic ulcers are, how many, how big. Okay, and CT scan also you can take to find this out. So treatment of peptic ulcer, clinical management is done. So you can take a screenshot of it. Don't practice it, but these are the medications usually used for peptic ulcer treatment. Okay, you give them antacids, H2 antihistamines. Okay, that can control the amount of acid that is secreted. Proton pump inhibitors. That is also antacid, controls the amount of acid secreted. Anticholinergic drugs, prostaglandin drug, because prostaglandin, it works as a defense mechanism. If your body is not producing enough prostaglandins, you can take the synthetic ones, okay, under prescription. And regular antacids also you can take systemic and non-systemic. And anti-H. pylori drug, that's an antibiotic. Amoxicillin, metronidazole, trinidazole, tetracycline, these are antioxidants, okay, to kill the bacteria. H. pylori is a bacteria. Then ulcer healing drug, carbenoxolone sodium, which can help in wound healing. And dietary management for peptic ulcer, sound total nutrition, that is balanced diet, okay, because there could be weight loss, excessive weight loss, protein loss, it has to be corrected. Protein rich food can be given, because since there could be a bleeding ulcer, okay, there is an erosion of the area of the stomach, you want wound healing to happen, you want more collagen and elastin fibers to come there and fix the wound from inside, okay, so protein rich food is recommended. Fat consumption should be in moderation, because if there is too much of fat in your diet, your liver will be triggered to produce more bile, okay, and too much of bile can also irritate the mucous membrane. Then carotenoids is vitamin A, plant-based vitamin A. Okay, consuming them through food or through supplements can also improve peptic ulcer. Ascorbic acid, that is vitamin C, helps in wound healing. Ulcers are basically wound that happens on your mucous membranes. Wherever you have a mucous membrane and wound happens there because of some biological, environmental, or stress factors, okay, consume vitamin C rich food, ascorbic acid rich food. It helps in wound healing. And correct the B12 deficiencies. If you have B12 deficiency, correct that. Otherwise, it can lead to pernicious anemia and all. Gas forming food, avoid that as well. Like certain legumes, okay, whatever you feel that you are sensitive to food wise, avoid that. Fiber rich food, it is good because uh, it can help in quick gastric emptying. Okay, the food will not stay in the stomach for a long time. If any food that stays in the stomach for a long time, naturally the stomach will want to produce more acid, produce more gastric juices, gastric acids to deal with the food. Okay, so if the gastric emptying is taking place quickly, okay, the stomach will not have to overproduce hydrochloric acid and put itself at the risk of forming more new ulcers. And avoid irritants like pickles, spices, alcohol, smoking. Okay, these kind of behaviors you can avoid. So far, is it clear to all? Peptic ulcer. Whatever is important, dietary management and all we are discussing. For bleeding ulcer and all, iron tablets also you have to take. Okay, if the peptic ulcer is bleeding, you have to take iron tablets to prevent anemia. Then gastric surgery. Gastric surgery can happen because of any to cure any gastric issues or to treat any some other issues. Okay, like some life changing things. If there is any perforation, hemorrhage, obstruction because of peptic ulcer, that has to be treated through surgery. When gastric surgery is done, the patient will be put on NG tube feeding because oral intake of food is usually avoided. Okay, based on where the surgery is done. Okay, quite farther away from that, food should be given. Like if the surgery has been done on the stomach, put the patient on NG tube feeding that ends at the duodenum. Okay, if the patient has some issues with the duodenum, some jejunostomy has to be done so that it can bypass the area, the tract where surgery is present. Okay, food should be given in such a way that you can bypass that area. Okay. So here you can see gastrostomy tube on the top image. Here you can see the J tube. J tube is jejunal tube. Okay, in the jejunum of the intestine. This corner right here is the first part of the intestine. Here you can see NG tube feeding given during gastric surgery. And gastric surgeries usually take a lot of time in healing. Okay, so the patient may be on NG tube and IV for a pretty long time. So that's about gastric surgery. Next we have is intestinal diseases. That is also very vast. Okay, that we will do in next class. I'm still recovering from health issues, so I cannot take long classes. If you have any queries so far, whatever queries if you have regarding the chapter, we can discuss here.